will start. I think I suggested that 3 minutes I can prepare and you can at the same time. So that's what I prefer.
Okay, so which one are you choosing to talk about today?
Okay, this card number 4. Yes, I mean page number 1, 9, page number 10. Okay.
Okay, can you just quickly tell me what the card is about at the top? It's say maybe at home at the...
Okay, it's you want the details?
No, just the one part, just so I'll know how.
You are okay. You are 32 years old and have a painful left ear.
Okay.
Left ear. Okay.
Okay, got it. I got it.
Well,
left ear. Okay.
I will. Yes, I will mute and start preparing.
Okay, now I'll set my timer for 3 minutes. Okay. Set timer for 3 minutes.
Okay, 3 minutes. Starting.
Okay, that is your 3 minutes. Now you will have a total of 5 minutes to have your conversation. You may start.
Hi. Hi.
Oh, am I supposed to be something or is it Nebula? You want
no, it's supposed to you, doctor.
So what do you want me to be, the patient?
Patient, yeah.
Okay. Hello, I'm the patient. So should I speak first?
Hello, I'm Dr. Sarah. I'm the treating physician today. How
Oh,
can I help you? I think you are coming for I think something related to your ear. That's right.
that's correct. It is. I've got this pain in my ear and I've had it for 3 days. It has just been so painful.
I'm so sorry to hear that. It must be have been very painful for you. But let me ask, if you don't mind, I would like to ask you some questions. It's okay with you?
Sure, sure. That will be fine, but it's my left ear that's giving me the problem.
Okay, I can see. Could you describe your pain?
Well, I was lying in my bed and I noticed that there was some liquid on the pillow and I wasn't sure why. So I got up and I checked and my ear was like a ringing in my ear. It has somewhat lessened now, but I'm still concerned.
Oh, I can see. Do you mean you have a change in your hearing level?
Yes, yes, I am.
Oh,
That's exactly what's
mm.
happening.
Could you tell me if does it occur all the time or just come and again, just now and again?
No, it doesn't happen all the time. It just happens when I'm lying down. Usually, when I'm lying down, I have the most problems.
I can see it seems to be difficult. I can understand your feeling. So could you tell me anything is any special thing make it worse or relieve it?
Uh, no, just when I'm up and there's no pressure on it, then I'm okay. But I still feel that I'm not hearing as well as I should be able to.
Oh, okay, I can see. So what about does it anything bring it on or aggravate it, like
I can't. I
noise
cannot think
or like
of anything in particular. I can't think of any
or
special thing that I've
position,
done.
change your position?
No, just
Yes.
when I lie down.
Okay.
Just when I lie down, I have the most pain.
Okay, I'm sorry for that. Well, Mrs. Jolie, let me explain you that I have many possibilities, but it could be an inflammation of your inner ear, middle ear called eardrum. Do you have
Hmm.
any idea about that? So it
No.
is not uncommon condition. It's related to our like a common cold complication. The buzz actually coming from your left ear, it's one of it's one sign of all the signs of this disease. So I think there is a pressure on your ears that need to be evacuated.
Mm.
So let me explain you. First of all, is that clear what is the disease or the condition you have?
Well, I don't know. I was planning to go scuba diving and swimming. And I know when I put that suction in my ear just to keep the water out, that bothered my ear as well. So I'm concerned that I won't be able to do some of the fun things that I enjoy doing. I don't know.
Thank you for sharing. But let me uh, tell you that it's very recommended not to try to go for diving and what else? Scuba diving.
Yeah.
It's not a good choice at all for your condition. Please tell me, explain you what is our management plan. We will go first to try to relieve the pressure in your left ear by making a small perforation. You don't have to worry at all about it. It's just a small perforation and it will heal by the time, but it will relieve your pain and resolve your condition. The second step is we will go to give you aggressive antibiotics, maybe intramuscular or intravenous, and a good um, pain analgesics.
Okay.
The
Okay. So that was be your 5 minutes.
Okay, I know, but let me tell me the last thing. We can reassess your ear again, and I can schedule for you a new appointment to check your ear. and check you. I hope you speed recovery.
Okay.
See you soon.
Okay. So I think you just want me to be aware that you know that you should say those things, but you should be able to say those things within the 5 minutes. Even if I'm talking, I think you need to just interrupt me so that you can be sure that you have advised me. I will give you more feedback, but just for now, um, you said, please explain my management plan. Actually, you should actually say, please allow me to explain the management plan as opposed to me explaining my management plan. But I'll say that again when I'm giving you your feedback. You told me it will heal by the time. I'm not really sure if that is really what time. You need to tell me when I can expect to see some improvement. And
Yes, it will heal within 2 days or 1 week.
yeah, that's what you should tell me. But it
Okay.
was just the way that you said it. And I was just making some quick notes, but I will explain more in detail when I listen to it. All right, so
Okay.
Nabila, are you going to do the same one? It's the
No,
same.
I send another card for you.
Okay, well, I didn't read it. Which card am I looking at?
I posted in the chat box. You can check.
Oh,
First one for you.
it might be easier just to tell me the number because I'm looking at something else.
Okay. Did you open the PDF?
Yes, I did.
Okay, so it will be page number 9
Page 9.
on the PDF, okay?
Okay, I'm looking for it.
It is,
Okay.
you are 45 years old, married with 13 teenage children.
7, 8, 9. Okay, I'm 45-year-old, married with 3 teenage children. You run a successful. Okay, let me just quickly read it. Okay, I'm ready.
Okay, I am ready also. Okay. Hi. Okay.
Hello. I'm really happy that you were able to see me on such short notice. I'm having, oh, hold on. I'm really happy that you were able to see me on such short notice. I'm having a terrible time sleeping. You may remember the last time I was in, my mother has Alzheimer's and she lives with me now, and it's creating such a problem with my sleeping and caring for her. So I'd like to get some sleeping pills, some strong sleeping pills, please.
Okay, I understand your concern, and thanks for sharing this information with me. But let me first introduce myself for you. I am Dr. Dawood. I am your physician today, and I understand you need to prescribe for you sleeping pills, right?
Yes, that is correct. I need the sleeping pills, the
And you
heavy dosed ones.
Yeah, okay. And you also have a busy lifestyle right now, right?
Yes, I do.
Yeah, yeah, okay. Okay, how would like me to address you?
You may call me Priscilla.
Okay, Marcella. Okay, first I want to let you know it's not go to prescribe sleeping pills for you, because there is a lot of side effect of these pills, like dependency, drug dependency, and there is another maneuvers we can follow, and I can help you to know more about it.
Okay. No, I don't really care to know about anything. I know the sleeping pills work, and those would be what I would like to have. So please just give me the prescription and I'll be on my way. I don't concern myself about becoming addicted or anything.
Okay, you come here to ask the doctor, so doctor can let you know what is the best for you. you don't come for me to only prescribe the thing you want, because I know what is the useful for you and what is the bad for you. And let me assure you that you can adjust your sleeping without sleeping pills. And you also you can do that through, you can first you can take care of yourself, because if you take care about yourself more, you can take care about other people. Also you can another second, you can take care about your diet, take healthy food, fruits and more water. Second, you can you can do some exercise, and it will help you to decrease your stress and give you a healthy life also. I think these maneuvers and methods can help you to decrease your stress, and you will not need for sleeping pills after that.
I don't know if I would agree with that, doctor, because of the stress that I'm under. I do understand that you're saying that there are some things that I can do to reduce my stress, but I just feel that the sleeping pills are going to be the best solution for me. So are you saying that I'm not going to get the prescription?
Okay, I understand your concern, but let me first help you with this to stress management. After that, if this doesn't work with you, okay, we can think about another management plan for you.
Hmm.
Okay, okay. Let me know more about your sleeping habits. When did you sleep?
I don't. Remember, I said my mom has Alzheimer's, so she doesn't have a sleeping pattern, but I have to be awake when she's awake because I don't know what she'll be doing. So I just get
Yeah.
sleep whenever I can, which is rare.
Oh, it must be challenging for you. I think it's good for you to ask someone to help you to serve her. Okay, and second one, try to make a time to go to sleep. Don't try to be busy all the time, and be careful the room to be dark at the night at the time of sleeping. This will help you to sleep well,
Hmm.
and also it will help you to decrease your stress in your life, and in the morning you will be energetic to serve anyone, and you going to your work actively.
Hmm. So you think if I go to some stress management programs that might be of value to me?
Yeah, I think I recommend you to try to align with any stress management. We also we have developed stress management program. You can join it. I think it will help you so much to manage your sleep and decrease your stress.
Hmm. Okay. So that was your 5 minutes. And I made a few notes for you, and I'll make more detailed notes on
Okay.
the back end. So I did get at one point, I got the impression that you were, you were insulted. You actually insulted me like you knew best for me, which is true. You may know best for me, but it may sound better to say, I actually understand what you're saying. But sometimes when patients try to diagnose themselves, they are too close to the situation. I'm only offering to you as a suggestion that you consider. I would also suggest that you get in that last part that you need to tell me about going to the management center for stress management. Somewhere you need to mention to me that there is a place where I can get support, especially if you have an Alzheimer's parent, people that have,
Yes, to seek support from others.
yeah,
And
yeah, you want to encourage me to seek support from others in a kind way. Maybe have you ever thought about, because I have heard from some of my other patients who have sleep disorders that it's due to stress or something like that. Okay, let me find out where Shady is. Well, I can't find out where he is, but he should be back in the room by now. Would you like to choose another one? Navila, choose another one first. Shade,
Okay.
Sarah, do you have another one? Tell me what number. I can read mine's pretty fast.
okay,
I can read both.
Yes, next one.
What
Next
number?
one.
What number?
Page number 11, that's starting with you are the parent of 10-month-old boy.
Okay. And what number for you, Nabila?
Okay. It will be doctor 8.
I
Page
will.
8.
Okay. I'm going to be number 8. Okay. Now, when you are, I know I posted, but I don't have it right here. I posted some things like 5 things that you all should focus on being sure that you're being empathetic. So
Yes, patient relationship, information gathering, patient information gathering, giving information, and structure.
yeah, make sure that you're doing that and make sure that I'm following that. If I'm not following it, you need to put me back
Okay.
because you are in charge, not me. Okay, so Nabila, well, both of your 3 minutes will start right now. Okay, your 3 minutes have started. Okay, so that's that time. Now who's going first?
Okay, I can go.
Okay, Nabila, and you had page 8 with 44-year-old patient, and I've got diabetes.
Yeah.
Okay. Okay, the time starts now. Hello, doctor.
Okay. Hi.
How
How
are
are
you?
you?
I'm okay. Well, not really. I'm here today because I'm really concerned about my glucose or something like that. What exactly is that?
Actually, it is a test measuring your glucose level in your blood. So it gives us about idea about the function of your pancreas. It is working good or not. Okay,
Well,
and actually the result back today, and I'm sorry to tell you that you are diagnosed with diabetes mellitus. But also, I have a good news for you. It is some of the diseases we can give you some drugs and some lifestyle changes. After that, you can be okay with it. Don't worry about it.
well, although you may say don't worry about it, I'm not even sure what it is. So is this the same as sugar diabetes?
Okay. Diabetes mellitus, it is a disease means that your body doesn't respond well to the changes in the your glucose level in your blood because of dysfunction in organ called pancreas in your body, which is responsible for control your blood sugar. Are you following me?
I don't know that I am. I don't even eat things with sugar. And you only did 2 tests. Could you be right? Do we need to do more tests? I just don't think I don't think I have it.
No, actually, only two tests. If they are elevated, it's enough for us to diagnose the diabetes mellitus, and according to WHO. And also, if you not conveniencing with that, I can send you some researches. You can read it, and after that, I think you will make sure that you don't need have any. You don't have to make any another tests.
I'm gonna have to
And
say I forgot to press
ah,
the button, but we'll keep going. So if we did more tests, you don't believe that it would show anything different?
no, no, it will not show anything. It will not help us to diagnose because only two tests it is enough for us to diagnose.
Mm-hmm.
Okay,
Mm.
and now if you want, I can tell you more about the plan of management for your
Yes,
case.
yes. Please tell me how to manage.
Okay, first we have to do lifestyle modification. Like you have to change your diet to be more healthy, and I recommend you to go to some dietitians. It will help you to give you the healthy diet for you, and also try to do some exercise, and it will help you to control your sugar level.
Mhm.
Second, I will prescribe some medication for you. Also, it will help you to control your case.
What type of medication would you be prescribing?
Um, yeah, I think you need some oral hypoglycemic drugs. It means drugs that will reduce the glucose level in your blood.
Okay, but you're sure I don't need to take more tests?
No, no, believe me, you can't. You don't have any. You don't need to do any another test. And also, I will give you some researches to make sure about this.
Mm-hmm. All right.
And I recommend you even if you don't make sure now you are have diabetes or not, try to start any preventive measure. Try to take healthy food and do some exercise because to try to prevent complication of the disease also.
Okay. All right. I didn't really get many notes taken for you this time, so I'll have to re-listen and give
Okay.
you notes. Okay. So let me make sure that I start the thing on time this time. 4 0 0. So what page, Sarah? Page 11.
11. Yes, the parent of 10-month-old boy.
Okay. I got my notes 7, 8, 9, 10. Okay. Hello, doctor.
Hello, I'm Dr. Sarah. I'm the treating physician today. I think nice to meet you both, and I think you are coming for your kid. That's right.
Yes, it's for little Tommy. I'm Tommy's mother.
Hi, Tommy. Welcome to see you both. How can I help you today?
Well, I'm concerned about Tommy. I'm still nursing Tommy, and he seems to have gastroenteritis. This is what I've read. I read a little bit about it on the internet, and it seems that he has gastroenteritis. I'm not even sure what it means, but could you tell me about that?
Well, it's my pleasure to tell you, but let me first ask you some questions if you don't mind. Could
Okay.
you tell me, could you tell me how did this start?
Well, as I said, he's about 10 months old. He's a 10 months old. And within the last 24 hours, he's had this serious bout with diarrhea. And it's lasted for 24 hours. Like every 8 to 10 times within a period, he has had to go, have a stool, and he's vomited twice, and he's urinating. He's going through a lot of Pampers now, and this is not usual.
Does he attend any daycare or like?
No.
Is there any ill contact in your house?
No, it's just me and Tommy. I'm a single parent, so it's just the two of us.
Okay, but it is start to crawling or creeping on the house. That's right.
Yes, he's able to crawl. Yes.
It seems that's the cause. And let me explain to you what is gastroenteritis. That's one of possible causes of your son condition. It's
Okay.
like an inflammation in the wall of intestine, the bowel intestines of your son. Okay.
Mm-hmm.
And in major, it caused by many factors. It could be very viral or bacterial.
Oh, but
In
doctor,
both,
my house is very clean. My house is very clean.
I can see. It is not uncommon condition for such a young age. It's very common.
Mm-hmm.
And the good news here, it's self-limited. It will goes by itself. Okay, so you don't have to worry at all. And I can see it. He is in a good health. So accordingly, I recommend you to first. I want to ask you: does he have any other symptoms like abdominal pain or febrile? Does he is febrile?
Well, he just seems to be sore in the nappy area. He just
Mm-hmm.
and of course he has a fever along with coughing. So I'm
I
concerned.
can
I'm
see.
really concerned about that.
Well, you don't have to worry because if you follow my advice, you will get recovery as soon as possible. Let me suggest you what we will do. First, we will keep.
So as you say, he will get recovery as soon as possible. As soon as possible.
Yes,
What does that mean?
I mean it's a self-limited. It will go by itself. No worries at all.
Oh,
Where
okay.
what we will
I think
keep
problem in connection.
compensate of fluids and we can if he still nursing you can keep breastfeeding him.
Mm-hmm.
Okay.
Okay.
And one thing I want to tell you that we still need to make sure of the diagnosis, so we will need a sample and send it to the lab to get the final diagnosis. Okay, that's
So what?
clear.
Yes, but what should I feed my baby now? I mean, in addition to the breast milk, should I give him something else? How much
In
water?
fact, that's a good question. um, a plenty of fluids. It could be by liquid breastfeeding and a plenty of rice, water, and please keep away from juices. Okay, but
Mm-hmm.
you can give him another fluids just to compensate the loss. Okay,
Okay. So
and this okay.
when the diarrhea has passed, what should I feed him? When the diarrhea
Uh,
has passed, what should I do?
Oh, okay. At this age, 10 months old, we prefer to give him all like smashed potato, like boiled with egg, except if they're yolk egg, okay.
Mm-hmm.
And we can give him fruits, vegetables, and smash the chicken meats.
Okay.
So
Okay.
almost all the table food.
Okay.
And the last thing I wanted
Well,
to tell you that uh, uh, if your child refused to eat initially, please persist on feeding him. That
mhm.
I think he will lose his appetite. So keep feeding him. That's good for him. Don't hesitate to call me if you have any concerns, and I'm waiting for your visit within a week.
Okay, so that would be a follow-up visit. So you want to be aware that if you need to have me know all of this information, you need to be sure to take control of the conversation and not let me ask so many questions, because that would, you have gone past the 5 minutes. Do you understand?
Okay,
So,
I have a problem. I tried hardly this time to make time control, but I don't
okay,
know what happened. I tried to give a good conversation.
so the way that you're going to get control back is just to tell me, I understand, uh, Miss Jones, or I understand Priscilla, and being a first-time mother, I can understand your concern. Let me assure you that all of the things that you are asking, these are things that I've heard before from other mothers. I do want to, then you're taking control. I want to suggest to you that you, whatever it is that you need to tell me, because that is the purpose of my coming, not for me to do all the talking. Does that make sense?
Yeah.
Okay, so you have,
No.
when you need to tell me something and I'm going off like I was arguing with you, you need to take control. I told you that I only had one child. I'm a single mother. You need to identify with me and say, I understand as a single parent and a new mother, but let me assure you that I'm going to give you good directions on what to do in this situation. This is showing empathy and letting me know that you are in control. Okay.
Okay.
I'll give you that feedback when I give you the feedback. Okay, Shady, I'm going to the Facebook page now to look for
Yes.
to look for your work and to give you feedback. I'm going to share my screen. Oh, there's your recording, I guess, Nabula. That was 3 hours ago. All right, so Shady, I'm looking for it.
Please refresh your web page. I posted it.
Okay, I'm going to refresh again. Did you put a color poster above it so that I could find it quickly? Okay,
Yes.
I guess, so it's here. So what is your video about? Tell me. What is it about?
First, you have to see not this video, the second one.
Not this one?
Not this one.
This one?
Yes.
What is it about? Tell me.
Yes. Computer department decided to add extra evening classes to students, as students already complain from that computer classes become more crowded, and there's enough time. There's not enough time to have classes, and the computer department decided to have an extra evening classes in the fall instead of buying new computers. From their point of view, it will it's kind of cutting expenses. The argument is that students disagree with this issue, with this decision, because most of students are engaged at evening with their families, sports, and so on. The second reason is computer devices already, prices of computer devices already decreased. They also have to hire new teachers for the evening class, so it will not be a kind of cutting expenses or cost efficiency, because they will hire also teacher with extra cost, and the cost of adding new computers will be less than hiring new teachers. Especially computer classes already large and they can add extra computer at this classes.
Okay. Now let's, and how long were you supposed to speak? 1 minute?
Yes.
Okay, I'm going to take a listen.
Yes, the student is totally disagree with that new decision.
Okay, so at the very beginning, remember, you should say something like, what is this about? That's an interesting question. This is an interesting position. This is an interesting, give me something that is going to lead into whatever it is that you're going to say. Do you understand?
Yeah. Yes.
Okay, I'm going to go over this again with you when I listen to it separately, but computers has an S. You said computer. It should be computers. Okay?
Yes, I recognize it after listening it for the second time.
Okay.
Yes, I have problem with the first video. Always I have problem with my first video. The second video will be okay.
Okay. And that's why you practice. I mean, you want to continue to practice. You can practice and put your videos in this Facebook page. It doesn't matter how many you put in here. It doesn't mean that I'm going to listen to them. I'm going to listen to the ones that you want me to listen to. But the more you do, the better you're going to get. And on the day of the exam, you won't get a second chance. Okay?
Yes. Yes.
So here you say they're busy with their friends, maybe practicing sports or whatever. Don't forget to use your transitional phrases, such as playing sports or, for example, okay? On the other hand, is good. They will hire a new teachers, I guess. I think it's going to be more than one.
Yes, I have problem with this video. So it will not be most effective because they will hire a teacher and
And did you said teacher again, so it should be teachers.
yes, I know.
Okay, so yours still, I think yours is going to, it's passable for the TOEFL. It's passable, but you want to get the highest score, strive for the highest score so that if you fall below, you still know that you're going to have the highest score. I don't know
Yes,
I don't know that I heard the phrasal verbs or your, well, you had your transitional phrases, but just know that also, I can't remember what it was that you said, but it made me think you should be using a different transitional phrase. Okay, what did you want to say, Shady? Shady?
Yes, I have to tell you that the needed score for passing my speaking session is 26.
26. Okay.
Yes.
Well, I don't think that you're going to have a problem getting the 26. You just need to keep practicing. Your mistakes are not of that magnitude. The problems that many students have is not being able to connect their thoughts. So you listen to an argument, you were able to understand what the argument was. Then two people were having a conversation, I guess, I don't know. Then you had to talk based upon what you had read and what you had heard, okay? And you did that It's just that what the things that I pointed out were going to be the weak points. Now, I will say that there are some people who can do extremely well, but they have a real good feel for English and they use English all the time and they don't need to pass with such a high score, but they're just so fluent and eloquent with their speaking. So speaking is speaking. And I can promise you, as long as you're talking about things in your discipline, yours, Shady, is just academic. It is not specific. It is not about the medical field. It is not about software or technology. It's just a general conversation. What the examiner is listening for is your ability to hear something and respond to it in a way that the examiner can understand. The same is true for Nabula and Sarah. It's just that you have a very specific discipline that you should be able to use words that are specific to your topic, which is, I don't know, gastronomic, whatever. I don't need to know what it means, but you need to know what to do when you hear that. The biggest part for Sarah and Nabula is your empathy and taking control of the conversation. This is my personal experience, when I go to my doctor for my thyroid, she never takes control of the conversation because I don't know what she's saying. I know what she's saying, but I don't understand what she's saying. And she doesn't understand what I'm asking her. That's why I need to get another doctor, because she's not a good fit for me. She may be a very good doctor, but I don't feel like she knows how to explain to me how not to be worried. So you need to empathize with me and say, I understand. So Nabila,
You mean lack of communication, that you should have a continuous circle of response and understanding. That's you mean?
well, no.
It means the empathy.
The empathy.
You can.
My doctor knows that she has to tell me something because she's got another patient coming. So she's not empathizing with me that I'm saying, I don't understand. We measured it last month. And well, what are we going to do different in 6 months? And she may say, well, in 6 months, we'll look at it again. I think I want her to say, I have had other patients that have had this similar concern with their thyroid. I can assure you that we are watching it. If you're taking your medication as prescribed, you're going to be able to feel good about what I've told you. I don't hear any of that. I just hear, take this medicine, come back in 6 months, and we'll measure it again.
Yes.
But that's not enough for me to know that she understands what I have. I feel like I'm in first grade when I'm coloring a book where it says 1, color it red. If it's a 2, color it blue. She's just following something, but I'm not there. So your biggest thing is to be empathetic. I understand what you're saying, or I can appreciate your saying that, or thank you for letting me know that he has vomited twice. I didn't know that. It didn't mean anything, but just let me know that you heard me say that my son vomited twice. So make me feel that that's important. That, well, I'm glad to know that he's vomiting. That way I know that he's throwing up something. It doesn't mean anything to me, but it sounds good. Like she's hearing me talk about my little baby, my only little child. That makes me think that you care. So the only thing that I'm saying is the difference is in the conversation. Your topic, Sarah and Nabila, is very specific. Shady's isn't. Shady's strength is that he doesn't have those unnecessary ahs that Nabila and Sarah, you still have them. You still
Thanks
have.
God.
I'm sorry?
Thanks God.
Yeah, yeah. And that is the biggest thing that causes the English language learner taking the exam, the problems, because when you are aware that you're saying it, it becomes problematic. I can say that for, I don't know if it's Nabula, I think it's Nabula, for you, because it is specific, you don't have as many O's as you did when it was in the TOEFL,
Yeah.
because you have something specific that you know you must say, but you still have them, but you don't
Yeah.
have
But
as
it
many.
is. Yeah.
So just continue to practice. And I'm going to say again, you all should use this Facebook page, practice in the Facebook group, Sarah. And if I'm
Yes.
and if I'm online, I will come in and listen if I'm online anyway with nothing more to do. And then I can quickly give you feedback.
Okay. I have a
So,
question.
so Shady, what I want you to do, I know you didn't have that much time today, but tell me which one you're going to do so that I can look at it and listen to it. Then I'll listen to you and give you feedback. I'll give you feedback on this one today, but I'd like for you to tell me which one it is so that I can listen to the reading or read the reading. Do you understand, Shady?
Yes, you are talking about the already.
The one you just did, the one that we just did.
Yes, second one.
Okay, but I need you to write it write it in the Facebook page so I can see it.
You know, you need to write the prompt.
You
Yeah.
don't have to write the prompt. You can just tell me the number.
Okay, number of TB4. Yes.
Yeah, just tell me it was TP4 and I can go to it. Okay.
Okay.
All right, Sarah,
Okay.
what's your question, or who has a question?
Yeah, me. Doctor, I want to ask if when I want to tell the patient that she will diagnosed with diabetes mellitus, how can I tell her about this?
When the patient says what?
And when the patient will be diagnosed with diabetes mellitus, how can I tell the patient this news?
Okay, I'm not, is that like at the beginning when either I didn't know?
Yeah, yeah.
Okay.
When I tell her that we have the result back, and I am sorry to tell you that you will be diagnosed with diabetes. Is that okay to say that, or is there
Yeah,
another way to?
well, a lot has to do with how that very first conversation comes. When I go to my doctor, the one that I like that is retired, he always, well, he knows who I am, and he'll say, Priscilla, it's so good to see you again. He probably says that to everybody, but it makes me feel like he's happy to see me. He says, I'm so happy to see you today. And he knows my son. He said, how is Edwin? But it's all in my file. But I don't know that that's the case with you. So I think it really depends. But if I'm meeting you for the first time, you will come in and say, hello, I'm Dr. Sarah. I will be your doctor for today. Dr. So-and-so is not here, but I have your chart. And then if I don't say something, like in 2 seconds, if I don't say something like it's nice to meet you, and I probably would say it's nice to meet you, then you can say, well, I noticed that your name is, well, tell me, I see your name here, but can you tell me your name? And then tell me, that's a very nice name, whatever it is. So that's a very nice name. And then you say, well, Priscilla, the information that I want to share with you today is that from the report, it has been determined that you have diabetes. And then you look at me and say, if I don't say something, do you understand what this diagnosis is? And I'll say no. And then you'll ask me, did you get a copy of the report? And I'll say yes. And maybe you'll say, well, let's go over this report together, or can you tell me what you understood? And I'll say, I don't understand anything. I don't have diabetes. Then you would say, well, just looking at the report, I'm only talking about the report now, just looking at the report, it says that you were diagnosed as having diabetes from whatever it is that you're reading says. Now, do you understand what this diabetes is? And I'll say, no, not really. Well, diabetes is whatever diabetes is that you know that diabetes is. I don't have diabetes. I can't because I don't eat sugar. I understand what you're saying because people at your age, they typically start to have symptoms of diabetes. And there are ways, I don't want to alarm you, but there are ways to control diabetes by doing whatever it is that you know on this paper. But I took 2 tests already. Yes, I understand. And that's normal. Taking the test twice is normal, and that's all that you need to get that first diagnosis, to get the baseline. Then we take it again just to be sure. And for now, it looks like you do have diabetes, whatever you said. Oh, well, do I have to take the insulin? I don't necessarily know that insulin is the best solution for you, but for now, I would like to recommend that you follow these procedures, and in, I don't know, 6 months, we'll reevaluate the process. I don't really know what to say. I'm just thinking about the things because I have diabetes and I'm thinking about what my doctor tells me. But my thyroid doctor, I'm not even going back to her anymore. When this COVID-19 thing is over, I will not be going back. And this is how they treat us now. We go to the doctor and we sit on the computer and she measures my neck, touch your neck. Well, and I ask her, what would we be doing? I need somebody to look at me in the office. But anyway, okay. Sarah, do you have a question?
No, thank you.
Okay, so Shady, do you know
Could you tell me if I have a little progression or
I'll do that. I'll do that
in the feedback?
I'll do that in the feedback. Shady,
Okay.
you have any questions? I have another class. That's where I'm trying to go.
Okay.
No, thank you. Thank
Okay.
you.
Doctor.
Bye.
Bye.
See you guys soon. Bye-bye. I'll send the
Bye.
recording. Bye.
Okay.
Bye.